Good.
Mm-hmm.
So it is well known to most Californians, especially people our age, that the legal age to consume marijuana recreationally is 21 and over. It is also well known that in California, the age to medicinally medicate yourself is 18 with a public marijuana card. Now you see, in other states that have not legalized medical use, or even recreational use for that matter, those who can actually benefit from the medical pros of marijuana are not able to. And those who are in states that do allow for medical consumption or ingestion of marijuana do feel pressured to not get a medical card when they're 18 for various reasons, such as not being able to obtain custody of their children in a divorce case is seen as being a fault on a parent if they have to rely on marijuana for certain illnesses or disorders. In other cases, it does pop up on background checks. And also, you do lose your Second Amendment right when you do obtain a medical card. It is for that reason, and reasons of medical benefits in cases such as PTSD and cancer, why marijuana should be federally regulated and legalized for across the nation, and for those who are of age 18 as an adult to make their own decisions on which routes they want to take for treatment. The first point that we need to come across in the discussion of legalizing marijuana federally is the stigma and stereotypes that surround marijuana and how to remove those. You see, in 1996, California proposed Proposition 215, and it passed, which legally allowed medicinal use of marijuana for terminally ill patients suffering from different diseases and disorders. What transpired afterwards was that 23 states proposed legislation similar with terminally ill patients or patients of different medical diseases and disorders. And it wasn't too far after, less than 20 years, that Colorado became the first state to legally allow recreational use of marijuana. And in 2016, California also followed their footsteps and allowed recreational use at the age of 21. What is seen time and time again with controversial topics as they become more accepted throughout society is that when they're accepted by authorities high up, that the stigmas and stereotypes might not dissolve away completely, but they do definitely lower and lessen and are seen as less harsh. So to fully open up the possibilities of the medical benefits of marijuana to people and to fully make them feel comfortable with the fact of partaking in it and not feeling discriminated against for doing such, it is important that we do federally legalize it so that way it is not seen as such a taboo topic and can actually be seen as a use of medical treatment. So in the end, or as in time, a joint at like the end of the day will be seen as like, you know, a glass of wine before bed would be completely normal. Moving on, one of the topics of medical use that can be used to treat is PTSD. And according to molecular psychiatry, which is an online article, plant-derived cannabinoids such as marijuana may possess some benefits in individuals suffering from PTSD by relieving nightmares and symptoms. And also Science Daily shows that those who partake in using marijuana for medical uses, for people who suffer with PTSD, see less symptoms of PTSD, less avoidance of triggers, which are certain situations, stimuluses around everyday life that may trigger a flashback, paranoia, or any other symptom of PTSD. And also it decreases the likelihood and the frequency of hyperarousal, which is sporadic arousal or sporadic flare-ups of PTSD symptoms, such as like hyperventilation again. And some say that yes, that we can help, but they also realize the possibility of bad highs and bad paranoia that can stem from marijuana. But as in any drug that is proposed in society, drugs do have side effects, and there are also different types of drugs and pills that have less side effects than others and have different effects on people, such as weed. Weed has different strains. There are sativas and indicas, which have different effects on the person. So yes, patients may go through a series of different experiences, but it could take just the right strain to help a PTSD patient cope with the trauma they've seen in combat. And it was quite evident that, from a personal example of mine, that marijuana can help those with PTSD. My grandfather served in Vietnam and came back very traumatized from his experience. He came out to visit when I was around 10 years old. It was my first time meeting him because he is my mom's biological dad, which he did not know for the longest time. And we were sitting in the living room, just, bonding. And my mom was in the kitchen gathering snacks to bring down to the pool for us. And she accidentally shut a cabinet too harshly and made a very loud sound, which triggered his PTSD on the spot. He started hyperventilating, he got very uncomfortable, and we had to, comfort him and calm him down and set it away. Flash forward 4 years later, we would actually took a trip out to his hometown of Galesburg, Illinois, and we are all hanging out in his garage, playing ping pong, having a great time, and I noticed that he's a lot more relaxed and a lot more just open and not so closed or not so, just on edge all the time. And I asked my mom about a year or two later, because we were talking about him and brought it up, and he said, oh, well, he actually started using marijuana to help out with his PTSD. So from that personal example and from other testimonies given, it's quite evident that it may not be end-all be-all cure, but it definitely is a valuable treatment. And then on to the last topic of cancer, which is a nationwide epidemic which still has no cure. The American Cancer Society does show findings that marijuana can ease the effects and side effects of chemotherapy, which are very harsh, including the symptoms of nausea and vomiting, that marijuana can limit those. Also, it shows that smoked consumption of marijuana can help with neurological pain, which is damage done to nerves through chemotherapy or just the cancer itself, taking over the body and destroying the nerves. And the typical munchies that those people who ingest and consume marijuana experience, that actually is beneficial, although some people see it as a burden of making them want to eat all the time. If you lose your appetite due to chemo, or again, due to just the cancer in general, it actually is shown to bring your appetite back to a healthy level or to a close to healthy level, which is very beneficial to those who are going through chemo, going through cancer, who struggle to maintain a well appetite. And again, there are counter arguments. People say, oh, isn't it counterintuitive to smoke something while you have cancer? Well, first off, cigarette smoke and tobacco smoke as compared to cannabis smoke is two separate arguments. Cannabis smoke is far less toxic. And also there are different routes to ingest marijuana and THC and CBD, which are the main components. There's also edibles as an option in baked goods and gummies. So those definitely do relieve the factor of inhaling smoke when treating cancer, as well as different vaporizers and pens that also are still inhaling, but they are less toxic for sure than actual smoke itself. So overall, with all the benefits that have been seen through studies for people with marijuana, with different disorders and diseases, it's quite evident that marijuana can be a helpful tool to help people cope with different traumas and disorders they have, and with cancer itself and other diseases. And I think in time, with people's mindsets changing and people hopefully gaining more of an open mind to the possibilities that can be approached with marijuana, that one day people will be able to reap all the benefits from a simple herb harvested from the earth. Thank you.
Amanda, have you got some comments for us?
That was really good. You had a lot of information and you seemed really prepared. I like that you had multiple examples. And the only thing that I really noticed was that you move a lot. Like you using your hands a lot and you're kind of rocking back and forth. And you stood really far back to the board, like I did. So I just noticed that. But you did really well.
Okay, I think the first 2 or 3 minutes of your speech are kind of a mess, all right? Where you're saying a whole bunch of things, you got this background information that you're talking about, I'm not exactly sure where you're headed. It's not until you're about 4 minutes into the speech that it starts making a little bit more sense and you start building an argument. I think you needed to get focused earlier in the presentation. Here's the point that I'm trying to make. Here's an example to illustrate this, or here's a story, or here's a piece of factual data that shows you why access to medical marijuana is important. You know, that's basically what your argument is. You're not talking about recreational stuff. You're talking about what the medical benefits of access would be, and I think that that's okay. It sounds like there's going to be a structure, but there's not really a preview at the beginning of the speech. You signpost the first points. First, we need to deal with the stigma. And we went, okay, so there's a signpost. That was kind of the last real signpost that I got. So I do think that there are other steps along the way in the presentation, but you need to transition and label them as you go to give the presentation a little bit more structure. The examples of things that it can be used to treat are fine. The PTSD information is okay. You had 2 quotes that you used there, and you also had the personal example with your grandfather. I like the combination of those things to illustrate that particular point. And then we kind of go off on this topic concerning the different strains and varieties and that sort of thing. I'm going, I know that there's a reason why this is here, but I'm not sure what it is and how it relates to the argument that you're making. That needs to be clarified. At the end, I think that the cancer issue needs to be developed a little bit more. You kind of spend your time trying to refute a rebuttal argument instead of building an argument that says this helps people through chemotherapy, it helps them manage their pain, it might reduce the extent of how wide the cancer spreads or any of those kinds of things. I think you need to build those kinds of arguments a little bit more. And instead, you're just talking about why tobacco smoke and marijuana smoke are different kinds of things, and you can do inhale it, or consume it in other ways. And went, well, that might be important to talk about some of the resistance stuff, but first let's build the argument that says that this is useful and important, and you're kind of taking it as a presupposition. I didn't think that you were moving too much, rocking back and forth. It seemed like it was a little bit more natural. You do hold your position a little bit further back than I think is necessary. I did notice, however, that you do the hand grasping kind of thing, that you kind of have a default position where you're holding your own hand while you're speaking, and that's not necessarily a bad thing if it's occasional. I didn't time it, but when you watch your own video, you can time it and see how long did you hold your own hand during the presentation, and I would guess it's more than half the time, and I think you could be a little bit more engaged that way. All right, thank you.